This is one of our Aging with SCI Ed sessions, and it's one of the ones that was identified as a clear priority when I did the survey many months ago. And it's shoulders and what happens and what can we do to prevent and how we can manage our shoulders again as we get a little older. I know people have had problems, and I don't think that Tova is here to um, solve anybody's problems directly, but Tova will go through what is general stuff and answer questions at the end. She has been a physio for 15 years, and many of those were at GF Strong in the SCI unit. She was actually my physio once, and now she has switched to a coordinator of the program. She says that now she doesn't do any real work, but she is now a coordinator of the program. That's only been for about the last 6 months, and she agreed to do this right away, and I was very, very pleased because it's the experts like this that agree to help us out that'll, help us live a little longer and a little healthier. So with that, I will turn it over to Tova and let her get started.
So yeah, I've been a physio for a little longer than I like to remember, and SCI is my home. I started my very first job was in ICU at BGH, took an interest in spine, moved to acute spine. I've worked at Praxis doing research. I've worked in outpatients and I've worked in inpatients. So some would say I don't have a lot of other skills except for dealing with spine, and that often means dealing with shoulders. I'm not going to spend a lot of time on anatomy, but I will just sort of briefly talk about why it's important. We'll talk about osteoporosis and fractures, posture, injuries, some specific thoughts about quads, pain, and then there were some questions that Dunk had sent me about like when is the right time to exercise, how much, when should I stop, all those sorts of things. So I'll do briefly about that. And then once we get through all of that, if you want me to go over like what I often recommend is like the very basics of strengthening and stretching, I do have another presentation about that. I can go over that, but I think a lot of you are pretty knowledgeable, so it might just be a bit overkill. So we'll just kind of see how things go. As I say, I don't really love to spend a lot of time on anatomy just because I don't find it that informative, really. Your shoulder is complex, I'll say that. And I'll say that it's really not meant to be stable. And that is what, as a person with spinal cord injury, we are asking it to be. We're asking it to do a lot of weight-bearing exercise with your transfers or your wheeling. We're asking it to do a lot of things that it wasn't meant to do without the help of other muscles that which when you have an injury, you don't have as many of those. And it's a very complex joint. It's actually 4 joints put together, and there's like 20 something odd muscles. There's 4 different sets of bones. It's just a really wonderful and strange joint. And then the other thing to know is that we consider it a ball and socket joint. And if you were to look at the difference between this ball and socket joint, which if you're looking at me here, it's like a really flat cup and a really round ball. And you compare it to your hip, which is also a ball and socket joint, which is a really nice deep cup and a really nice round ball. That's stable. But your shoulder is this. And so there's a lot of this kind of stuff that can happen. It can move around a lot. It really wasn't, as I say, designed to be weight bearing. So just things to think about why do we struggle so much with this as people, in the SCI world, why do our shoulders not love living in this world? Again, I don't want to talk too much, but rotator cuff is the word of the day. It comes up a lot. These are really small muscles that are supposed to stabilize the joint a little bit. But they weren't necessarily meant to take the forces, the amount and the amount of force per push, so to speak, and also the amount of repetition that is required in spinal cord injury. The other thing I'll say is that these are really dependent on the position of your shoulder blade. And we'll talk later about posture, but posture, if you think about the job of your posture is to set your shoulder blade in the right place. If you don't do that, your rotator cuff is put in a really rough position and it just gets like, I consider every transfer, every time you push on your wheel, if that's sandpaper, if you push harder on the sandpaper, you're going to be wearing down those little tiny ligaments, tendons, and muscles a lot faster. So the next question I had was about osteoporosis and fractures. I'm going to point you to a resource, and some of you may know already about it, that was done by Anita Kaiser and Hope Jervis Rademeyer. They did a podcast called Bare Bones, and it was an 8-part podcast about osteoporosis and fractures in spinal cord injury. They also have info sheets. You can go to sceifragments.ca. And it's really informative, and it's really like easy language. They brought on experts, but it wasn't like, even though it's 8 parts, it's not like 8 hours of your time. But it's just each little part goes into what should I do if I have a fall and I'm worried about fractures? What is osteoporosis? How is it diagnosed? What are the things I can change and not change? And so I pulled this little info sheet off of there about what are the risk factors for fractures and what can you control and what can't you control. There's a lot of things you can't control, because osteoporosis is your body saying, oh, you don't need that bone because you're not weight bearing on your legs, or you don't have the nutritional information or like the nutritional inputs you need to keep your bones. I'm going to steal that calcium. I'm going to steal that bone health and put it somewhere else or get rid of it. So bodies are use it or lose it bodies. And so that's really what we see when we see osteoporosis. You're not using it, or you're not using it in the way that bodies were evolutionarily made, then they start to get softer bones. And that happens in regular, able-bodied populations too. So risk factors in terms of things you can change. Alcohol is a big one, really surprising. But we notice that people who are have high intake of alcohol, that can really change their bone density. Not doing weight bearing or exercise, so trying to find a way to really pull hard on those bones without breaking them, or put weight down through them is important. Those things I talked about. So vitamin D is super key. You can look at get a vitamin D test, but they recommend vitamin D for everybody. So I think you're safe to say like taking a vitamin D supplement is a cheap and cheerful way to help your body in many ways, but especially with your bone density. And of course, they say low bone mineral density at the hip and knee, but that's how much you can change. That is challenging. And then there's also a role for looking at your medication. So are there ways that you can reduce the use of these things, knowing that, of course, you need to live your life, and if you need them, you need them. And then the last one, especially for postmenopausal women, and many men after SEI, looking at your estrogen and testosterone levels. Something that I think as time has gone on, there's been a lot more in the like the physiatrists have really been better about looking at. So, don't be afraid to ask your GP or your physiatrist about that. Obviously, there's lots of things you can't change. Your age, how long you've had your injury. Interestingly, paras, for various reasons, they were able to see more below the level of the injury than some quads. But I think that has to do with completeness and incompleteness, which is the next thing. And then if you have family history of osteoporosis or fracture, as well as any other medical conditions. Any questions about any of that stuff? Or the resources?
I have a question.
Mm-hmm.
I know a few people who are getting older now, who've been in a chair for a few decades, and this is coming up a lot. But it's interesting, I actually see, it seems to me that more paras have the issues than quads, and I can kind of guess an obvious reason maybe why. I'm going to guess, I don't know if there's research done on it, but my guess is quads get more help with ADL, and paras just have struggled to be independent as much as they can. Now, I'm a quad from the old school, just like Duncan and a few others here. So we had to struggle too. We weren't allowed to have a power wheelchair back in the day, and we went without a lot of aids. But anyways, it's great that they're recognizing this long term. But I also think there needs to be a balance, because I do see far too many people coming out of GS Strong right off the bat. Like, and I don't know all the circumstances, but when I see pairs coming out straight out in a power wheelchair, only using a lift with caregivers, I don't know how the pendulum swung so far the other way.
Yeah, it's a really interesting discussion. I don't know if we have time to totally go into it. I'll just say that as the population has been aging, so has the age at injury in SCI. So I'm not treating someone who gets injured at 25 the same way that I'm treating someone who's injured at 65. So we'll say like our jobs have changed a lot. I think it's an old person thing to say, but like I could never have guessed that we'd be seeing so many power chairs. I see it too. But the job has changed because the people who are getting injured are changing.
I have a quick question. With the osteoporosis and with the inactivity statement around your bones and your muscles, I've heard lately, this is kind of new to me, but it might not be new to everybody, that it's really good to hook yourself up to an FES pedaling machine. And is that going to do, it's going to do some good, I imagine, because it's going to get legs moving.
Yeah. So we know that anytime you're asking muscles to move, it's sort of that statement, you got to pull on the bones or you got to push on the bones. So weight bearing, push them down, exercise, pull on them at the tendons, which is kind of physiologically. There is some reasonable evidence to suggest that can help reduce the loss of bone. It's not going to put your bones back. Your bones, you've heard that statement. I think I feel like it's more for women than anybody, but like they say, like you have a bone bank, right? So you build up your bone bank when you're young, and then over time you're losing it. They have like drugs that can help to reduce the chances. Like some of you may be on bisphosphonates and that kind of thing. I won't talk about that because it's just not my expertise, but just to know that we're reducing the loss, we're not building bones back up. Does that make sense?
Yeah.
But yeah, there is reasonable evidence that using FES, and that's actually, they have a really good on this SCIfragments.ca. I should probably have included it. What can I do in terms of exercise and weight bearing? And they're big on, they actually say that FES, even if you can't afford a cycle, because that's like 20 odd something $1,000, or if you're able to get to a park where they do have one, that's great. But just knowing that isn't feasible for everyone. And that you need to use it a lot for it to be functional, that using even like local FES units on like your big muscles, your quads, your hamstrings, and doing it against resistance actually has shown some positive effects. So I thought that was a really interesting point that they made.
I also heard that it was really good for arterial management.
Yes. Yeah, we have good evidence to show that FES cycling is one way that people with higher levels of injury who struggle to get cardiovascular exercise, so like you never are getting your lungs pumping, so to speak. It's really challenging, I know, for a lot of quads to do that, especially for those of you that are totally immobilized. It is one way that they've shown like it's good for your heart, good for your lungs, good for your circulation as well. I know lots of people love it for other reasons, like if they find it's really good for their skin, because just keeping like the muscle bulk, because you're not losing your muscle. But if you don't have that extra 25 grand sitting around, and that's the cheapest one we have, the MyoCycle, which we've just started using the last about 5 years.
Okay, I have another question. I hope I'm getting it right. What's the difference between just an FES peddler and just an automatic peddler? So
Great
if you
question.
strap your feet onto something that just automatically pedals, you're still getting the movement, but you're not getting functional electrical stimulation.
That's correct.
Pedaling.
Yeah,
But
so it will still pedal your legs for you.
Yes.
But you help it along with an electrical signal that is mimicking what your brain tells your muscle, or used to tell your muscle to do, depending on how your completeness of your injury, to push the pedals along and pull it. So usually what happens, and everybody's the same, but you have electrical pads on your quads, your hamstrings, and your glute muscles, so on your bum. And we use those because they're big muscles, so it's one way. But like the research shows, if you want cardiovascular benefits, you got to do this like 3 or 4 times a week, which like it's kind of a pain to set up. And it's like a lot of people who can afford it or who can get it through their funder, they find it's like a very expensive clothes hanger, is the joke that I hear a lot. So you have to be somebody who's really going to do that. But that's the difference. So a peddler will pedal your feet An FES cycle will pedal your feet, but then it will time it with your quad to straighten your leg and your glute to straighten your leg and your hamstring to pull the leg back. So it's timing the contraction with the spinning of the pedals.
Okay.
I recommend it. I'm not against it. I
still
just
have
like
questions in my head,
practicality.
but I don't know what they are.
Yeah. Yeah. That's
Okay,
how I live my life.
sorry.
Questions in my head, but I don't know what they are. Yeah, so there was just on that website, seifragments.ca, there's one of the info sheets that has a little box of like, how should I be, if I'm worried about this, what should I be doing in terms of exercise and weight bearing? And it's really great. I should have included it. Posture wouldn't be a good physio if I didn't talk about posture. As many of you know, gravity is mean and it creates curves over time. Pretty hard to get away from this. You know, I think we've learned as therapists over time to try to attempt to help people have better posture instead of feeding into the kind of C-sitting that a lot of people need for their stability. Don't get me wrong. But we are maybe have learned sometimes to try and keep people a little more upright, and to know that the more you can keep someone upright, the research suggests that it's good for pain, it's good for breathing, it's good for general health, and it keeps you from needing custom seating. Which, in terms of things that will eat up your time in your life, custom seating is a good one, as many of you I'm sure already know. There was a study, the University of Pittsburgh, and I'll share one of their resources in a minute, has done a lot of research on how do we mitigate shoulder pain in manual wheelchair users. The number one thing in terms of wheeling was putting people more upright. The problem is that people don't love it for when they're just sitting still because you feel a little more unstable. So you got to find ways to like find the balance there. And I don't have the perfect answer. It's something I've always fought with in terms of like my clients who've aged with an SCI and how they're gonna, where do you draw that line in terms of like, this doesn't work for my life, but it is theoretically better. There's theoretical, and then there's like, what are you actually willing to live with? And I know that those are not the same thing always. Yeah. I'll just put a little plug in for your head being heavy. The weight of your head, you know, if you kind of look at these three pictures here, your head is 12 pounds if it's sitting right over top of you. But if you let that head go out, you're asking your muscles to hold on to a 42-pound weight all day, every day, anytime you're upright. And so when you were wondering, why is my neck sore? Why does my shoulder feel like it's trying to hold my head on? You know, that sort of thing you see in people with what we call a kyphosis, that sort of forward head, thoracic spine that's bent. Why do they look like they're using their shoulders to hold their head on? Because you are. So just knowing, don't underestimate how hard on your body this is for people who are already living with this, like knowing that it's not an easy thing you're doing to hold your head up. And especially for a lot of people, you know, just to look up is not an easy thing to do. So trying to find ways, if you're still flexible, to get out of that position, and then if you aren't there yet, to stop yourself from going that way. And knowing that for some people, that's just, you know, you can't live your life without being a little bit forward. You know, that's just how it is. Like, I'm not telling you you're a bad person. I'm just telling you, if you can stay away from this, it would be great. Yeah. Yeah, so ideal sitting posture, we want to look at, we want our chin to not be poking out. We want shoulders down and back. We don't want to have this kind of shoulders sticking up in your ears. We want to stay away from that curved upper spine. And if you can, really, if you're a lower level injury, or if you're incomplete, trying to actually get your abdominals involved in making sure that you're kind of keeping that body upright, and not only depending on, you know, whatever, if you're seating surface that you're on. It's also, the research has shown, like, good to engage the muscles you have. But I know not everybody has those. So, and knowing that, again, we want that lower back to be in that, can we find a neutral position that you can live with? And that's something you can work with your vendors, your OTs, your various team members, if you can. In terms of people are asking about what are other things in your life you could change in terms of your posture, I'll put in a good plug for your pillow. I find that's can be a really nice one, because if you're waking up in the morning and your shoulders are sore, are you, especially if you're a little broad shouldered, or I'm tall, so I find my neck is quite long. So I switched to a foam pillow that has that curvature that you're seeing when it says good fit. I use one from IKEA. It's not complicated. It's not very fussy. Took me a while to get used to. But for me as a side sleeper, I'll say, I should have said at the beginning that I have a frozen shoulder and also like referred pain into my hand. So I'm not saying that I'm expert in the SCI problems, but I have struggled myself with some of these problems that with shoulders and with neck problems. So just being thoughtful about your positioning in whatever places you're in your car, in your bed, in your chair, all of those things. It's not just about one place. It's about building a whole constellation of places that don't do your body much more harm. Any questions about any of that?
I don't think so.
Okay. Another question that came up is, how do people get injured? Don't have actually the greatest level of evidence on this. My personal experience, and like one kind of not the best paper I've ever heard, that the way people get injured is transfers and fall out of the chair, which maybe is logical. And so, how can we mitigate that risk? How can we like reduce the chances that we're going to fall? Or that, especially during transfers and especially in the bathroom. If there is one way I've seen hip fractures, it is transferring onto when you're wet, or if the surface, like the brakes on your chair have gotten, a little loose, and then the floor's a bit wet, and then you don't have your pants on, so everything's a little stickier or slidier, depending on what state you're in. Just being really thoughtful about how you're doing those. That is, from that research paper and from my personal experience with my clients, bathroom transfers is a big one for sure. In terms of those of you who use overhead lifts, I would say the number one thing in terms of transfer, or in terms of injury, is more about caregivers and how they're handling you. So making sure that you're not getting your shoulder pulled on is a huge thing. I know that can be really challenging though, especially if your caregivers are busy and you're trying to get moving and all of that stuff. So just really teaching, if you have control over that, which not everybody does, trying to teach them to manage instead of pulling on the hand or the arm. Grab my arm from the shoulder blade, like grab the whole quarter of me and move that together so that it's not being pulled on from the fingertips, so to speak.
I think another thing that we need to say is, as we get older, you have to realize that at some point you're not going to be able to do the same types of transfers that you used to do.
Yeah.
And this is especially how I got hurt, because I bought a car and the transfer from my chair to the seat was like 12 inches. And I pulled up my shoulder doing it, because when I was younger, I could do that. But I was like 60 and I bombed out, and that's, been a problem ever since. So I think as you get older, you have to look at your transfers, make sure that you can do them because when you're a kid, well, not a kid, but when you're younger, you just think you can do anything. So we have to watch out for that, because it can be a real problem.
Yeah, I'll talk about, it's something I really think about a lot, is like, how do our bodies change as we age, and how do we have to be responsive to that, hopefully before an injury, but certainly after one as well. Arnie or Jeff?
I think you could maybe add like a sliding board.
Yeah, I have that on my.
I was going to say
so what are the tools, right?
Yeah, I was going to say that maybe at the end we could Because one of the ways that information gets transmitted really well in the spinal cord injury community is person to person. And I'm thinking we got like 20 people here that are all a little older and have probably all done something to make their transfers a little easier. And I was thinking maybe at the end we can have a little discussion of like techniques or devices that people have used that other people might not be aware of. Does that sound okay?
Yeah, that's a
Okay.
great idea. Good for me as a therapist too, to
Yeah.
feed that back to the team. So yeah, just like Marty was saying, a transfer board, you know, you have to kind of get, especially if you never used one before, or you used one only when you first started with your injury, and then you're like, I haven't used one of those in 20 years, or whatever it is. Can you really look at where you are and where you expect to be? Like maybe if you looked ahead in your life 2 years from now, and you made decisions that, you know, kind of respected where you're about to be, you know, if things are changing for you in terms of your strength, in terms of your ability to do, and maybe it doesn't have to be all the time. You're feeling good, just go for it. But you're, you know, it's the end of the day, you've been working, you've been out. Okay, well, like grab the transfer board. We sell them here at GF. You can buy them online. Marnie and Jeff make some nice ones. You still got, I don't know if you guys are still doing that. They're lovely. Yeah, so just it's hard, right? You don't want to change. You've been doing the same thing for a long time. And also, I think just like Kim said, like, you know, if you're old school and you've been doing it this, you know, you got going and you had to struggle and all of those things, there's a part of you that's like, oh, I don't want to go there. I don't want to go to that lift. I don't want to, but I would only say it's okay for you to make that decision. It's your body, it's your life. I think the only thing I'll say is sometimes I see people do a little better that instead of waiting until things go totally wrong, you just make that, you know, maybe it doesn't feel great, but like, could we once a day even just take one of your transfers and turn it into a sliding board transfer? It sounds silly, but those little things can make a difference. I'm hammering away on transfers for some reason. This isn't the only way we have trouble. I talk about some other resources in a second. The other thing I'll point you to is I was talking about the University of Pittsburgh. They have these really great body of work on managing shoulder pain. One of the things they have is an online transfer training course. And I know it sounds silly, you know how to do transfers, but it's little things that can improve the safety, reduce the chances you're gonna have a problem in terms of causing any particular joint, including your wrists, including your elbows. How do we reduce the stress on each joint during the transfers? Because we focus a lot on, oh, wheelchair setup for wheeling. But in terms of like, what are the things that actually do the most damage to your shoulders? It's not necessarily wheeling. It's more about those big lifts, you know, trying to move your body as much around there. That's a lot harder on your shoulders. I talk about that in a minute, but a transfer is harder on your shoulder than a day of wheeling is. If you have to do 6 or 7 transfers, I mean, just counting up your transfers is one thing. Yeah, I think I'm getting ahead of myself, but yeah, it's a really great little course they have it for clinicians, but also for people like yourselves, just to like go through a checklist. Like, oh, am I doing that thing? Am I putting my elbow at a weird angle? What am I doing that I could maybe just reduce the stress on my body? And of course, safety bars and lifts, and there's all kinds of stuff out there. And knowing, you know, again, could you look ahead in your life in like 4 or 5 years, like, oh, maybe I am going to need a lift at some point. Maybe I'm going to go get that a little earlier than I might have normally done it, just to take the stress off when I'm tired. Because what happens is not so much when you're feeling good that you're going to hurt yourself. It's you're tired. You just come home. You really have to like use every ounce of your energy to transfer. We call that like a physiologic barrier or like threshold. And after that you're going to hurt yourself, right? So morning time transfer is here. Nighttime transfer is here. Okay, can we change that nighttime transfer? Doesn't have to be everyone. So just those small changes to kind of lengthen out the amount of time that your shoulders are gonna help you do those weird and awkward transfers, knowing that, you know, it doesn't have to, nothing, you don't have to change your whole life at once. I think one thing I notice about people with SCI is you're so used to living with pain of one kind or another that sometimes you're not realizing how much it's affecting your life. I don't know if I'm being, if I'm calling out, or if I'm being too generalistic on that, but I do find, especially for people who've had had their SCI for a long time, you're used to living with pain. And the problem is that pain is a signal your body's trying to give you. And sometimes you have to get on with your day and you can't listen to it. I think other times it might be worthwhile to really check in with yourself and just notice the ways in which your pain is limiting your life, and what you could do to mitigate that. So there's lots of things we could change. And like I say, it doesn't have to be all at once, and it doesn't have to be everything. These are just some ideas. And I think, like Duncan says, maybe we should be talking, like you all know more than I do about this, right? So I don't know that I'm telling you anything you all haven't already heard. I think it's just bringing it all to one place for us to have a more productive talk about it. I think less and less, like Kim says, we've been changing what we tell people to do. One of the things we don't see as much, but people, you old school folks are maybe still doing, is like the lifting the chair into the car, the pulling chairs into awkward spaces. For those of you who are maybe incomplete, putting things into the trunk of the car, those sorts of things. Where is the moment at which your shoulder, lifting at some awkward angle is really hard on the rotator cuff. The weight of your chair is another big one if you're lifting it, but even for those of you who have like power chairs where you're adjusting your cushion, if your cushion's like 15 pounds or 10 or 12 or whatever it is, some of those cushions can get pretty heavy. And if you have to adjust it, and you're like ripping in the Velcro off and doing all of this stuff, just those small things can add up over time. The setup of your office, that's something I've been struggling with of late, where I'm not used to working at a desk. It's my first time in 15 years working full-time at a desk, and I'm having quite a lot of trouble, I think because I'm so tall, just trying to find the right setup. And then where can you reduce the number of repetitions? So if you're doing something like whatever it might be, you're playing sports and something, don't stop it. But where are those places where could you set it up a little bit differently? Or could you have the setup not always have the exact same chair setup, because that's the exact same place in which your shoulders are getting, sort of having stress put on it. The other thing, I worked with someone, this is a while ago now, but one of the things we talked a lot about is the number of transfers she was doing in a day. And I'll talk about it in a second. What else can you change about your lifestyle that could change that? But we counted it up, and it was by the end of the day, because she was doing, she was voiding on the toilet. So she's transferring quite a bit onto the toilet during the day. But it was just, and for those of you who are overhead lifts, this applies to you as well, getting back into bed. If you find that transferring puts stress on your shoulders for one reason or another, count up your transfers, right? In and out of the car, or in and out of a different chair, in and out of the house, so for some people it can be like, are we talking about 10 transfers? Are we talking about 6? What's the number? Because that is really, really hard on you and for some of you, your caregivers and your family and that kind of thing as well. The setup of the transfers I talked about already, but I think that I would also say that includes people who are using lifts, the type of sling. For some people, it can make a big difference to change the type of sling you're using. And there's so many new ones out there. Like people are always bringing me new and exciting pieces of gear. But like a sling that doesn't put pressure on the shoulder, for example, that doesn't do the bear hug, but more leaves the shoulders open. There's some really nice things out there in the world now. So just maybe even looking at that, and that can be really successful as a way to mitigate, like if you're using a lift, just stopping the amount of pressure your shoulders get. Wheeling is not the worst problem, but it's not a problem. Looking at power system, power chairs, are we there yet? Is that something you want to talk about? And then wheeling, because it's not usually flat wheeling that's really a biggest issue. It's over obstacles and uphills. and if you're weighing your chair down, whether that's like you have a huge backpack or you're got your toolbox on your chair or whatever it might be. And then, a wheelchair setup is also a huge issue. Understanding the physics of your wheelchair took me 10 probably years to really understand that, and knowing that you can reduce the wheeling resistance by adjusting your axle 1 inch or whatever it might be. Those are small things that can make a big difference. We'll talk more about exercise, but like making sure that the exercise you're doing, if it's causing you more pain than good, then it's probably not what we're after. Any questions about that? Straightforward.
Yeah.
Yeah, so then here's my moment where I talk to you about what are other things in your body that we could be maybe looking at to change to reduce the pressure on your shoulders. There's been a big move towards suprapubic catheters, for better or for worse. I know that's something it's a bit divisive. For some people it's really successful, and for other people it can be really challenging. That being said, every time you have to catheterize, it means you have to get out of your chair, which I know for some people, just for whatever reason that they need to do that, or even you're having to put yourself and your body in a weird position that for whatever reason hurts your shoulders, then is this the time when we can have that conversation? Colostomies, if you're sitting on if you're having to do, your bowel program is just not going that well, you're having to do twice a day bowel routine or something like that. There's 4 transfers. Well, we hope it's only 4, but probably it's more than that, right? If you're going back to bed to get changed or whatever it might be, that could be what 1, 2, 3, 4, 5, 6. We could be talking about a lot of transfers and a lot of wasted time, right? I think as we age and as bowel programs get more complicated, because I think they do, I think the way your body does a bowel program when you're young and the way it happens as you're aging are different, and that has to do with the way your nervous system has changed over time. It's not just because you're not trying hard enough that your bowel program has gotten longer, or more complicated or less predictable. So I think we think of these things, well, that's a bowel program problem, but if you're having to spend a lot of time trancing on and off of off of a commode, whether that's overhead lift or otherwise, that's a challenge for sure. And then weight reduction. Physics is mean. I think, gravity affects a bigger body more. There's no getting around that, right? I mean, I think it's really hard to lose weight as a person with SCI. I would say it's one of the most challenging things that someone with SCI will do. There is a little bit of research to suggest that it's not impossible, but it may be something to talk with your doctor about. There's been some use of the same as in the able-bodied community. We do have some people looking at different kinds of drugs, like the Ozempic class drugs and that kind of thing. I mean, there's not a lot of research in SCI, but that's something, knowing that your shoulders have to lift a heavier weight. If you are bigger, that's harder on your shoulders, and I think on your body generally. But yeah. Go ahead, Kim.
Yeah, thanks so much for the presentation. It's great. Some of us are so used to seeing Shannon for decades now.
I know, yeah. I'm a Shannon disciple.
Yeah, you sure seem like it. You're doing a great job. Yeah, I'm probably 20 pounds overweight. I've been underweight at times, but mostly I've been overweight in my life. I know another peer of ours, it was amazing. He took Ozempic, or I don't know, I think it was, his name's Jeff. Some of us have probably seen him. He lost a ton of weight. I think it was over COVID. Like, he even looked half the size. But I thought about going to my doctor to help me with that 20 pounds that I can't seem to lose. Well, I guess I could have, but I don't even eat that much. I've talked to my other peers. We only eat like 2 meals a day. and we're not drinking pop and all kind or alcohol or anything, and it's still hard to keep the
No,
weight down.
it's so
Do the
challenging.
doctors listen to that to people, or they want them like more morbidly obese people, or like I don't know.
That's a really good question that I don't know the answer to. It's such an
Yeah, I
evolving
wonder.
field right now.
Mhm.
I think if you you say to them, listen, me being overweight 20 pounds really limits my life because I have to use my shoulders for everything, and the heavier I am. I think if you really point it to them like how you're different than an average person, and there's so many things about it. Like as I say, I'm not recommending that. I'm just saying that like
No.
just like in the able-bodied population, things are changing about how we lose weight. And you know, but just I say this to all my clients, the new ones especially. I tell people like the number of calories your body uses. Let's say you're a quad. If 2,200 is the average adult, you're using, we think, anywhere between sort of 1,000 and 1,300 calories. So it's like half.
I agree with you. And my
yeah.
doctor sent me to a nutritionist, and she was suggesting far more than that. But I know
Totally, and you know,
like,
right?
I already know I can't consume 2,000 a day.
Yeah,
it's hard to wear it off too.
yeah, and I think that's where like we tell a lot of people, I'm like, you liked beer before, you don't like beer anymore. I'm sorry. Like it's too many calories. You will never get enough because you need to eat a ton of protein. You need to keep your body healthy, right?
Actually, they can still drink beer. I just bought a whole bunch of non-alcoholic beer for my
there you go.
husband,
Excuse me.
and they're
Sorry.
anywhere from 10 calories to 50 if they still
There
want
you
that
go.
taste.
I'm sorry.
So there
I'm
you go.
sorry.
Just thought I'd put it out there for those beer drinkers.
Yeah, I'm being facetious, and for lots of people, they figure out a way to manage that in their day. I put the fear of not God, that's not right, but like I put a lot of fear into people when they leave here from inpatients. Like if you gain weight, your quality of life will be worse. And trying to carry that weight around will limit you functionally, right? So I know I think I'm supposed to be a little more PC than that, but it's the reality. And I think all of you know about that, right? If you're aging and you're gaining weight and your body isn't as strong as it once was, and I'll talk about aging and what that does to our bodies in a minute. Yeah, just being aware of how that compounds. Like it's not fair to any of you. Like there's no question this is not a fair game that you're playing, aging with an SCI. The cards are not in your favor, right? So you really have to be thoughtful about that, about all those other things. But just to know that it's very hard. Like if you are only needing 1,200 calories a day, and from the research we know you need to be in a calorie deficit of 600 calories to lose weight, the math on that ain't great, right? So that means you're eating so little that you probably aren't getting enough to like sustain your body, right? So just to know, I know that it's very challenging. I'm not telling you should do this. If it's worth asking for help, I think that's reasonable. Talk to your doctors and stuff. So yeah, there's a lot of discussion in the chat box about some different therapies. Yeah. I looked at the one. Thank you for emailing me that, Marty and Jeff. I just don't know it, and I can't speak to it myself. There's a lot of really amazing, technology is always changing about, how we treat different, like these sort of shoulder things is such there's a huge market outside of SCI as well. So there's lots of things out there. I just don't know it myself. So I can't really speak to the different like light therapies and the shockwave and that kind of thing. There isn't great evidence, but that doesn't mean it's not going to work for you. When I talk about pain, for example, I tell you, your life is an experiment of one. It's your life. If the regular stuff's not working, try some other stuff. And if it works for you, then great. Like you don't have to justify it to anyone else but yourself. It's your life. So yeah, that's my plug for not everything can be, randomized control trial. So.
Okay. How are you doing, Tova? Okay, go.
I'm doing pretty well. Oh, geez, we're getting down to time. It happened.
Yep.
I'll just run through this quickly and then we can just chat. Shoulder surgery, not always that great. Some people works well. A lot of people in SCI, the research says that it's not hugely successful. So not to say you shouldn't talk to your doctor if you need it, but it can be quite debilitating to go through that process. And then the research would suggest that it's not as successful as people would like it to be in terms of like rotator cuff surgeries and that kind of thing. That being said, there are people who have really great outcomes. So yeah. Quad problems. How do you exercise if you have little and no active movement? It's very, very hard. From those of you that have been to GF over the years, we use a lot of slings and that kind of thing. I think getting gravity out of the picture is one way to do it, even if you only have very small amounts of movement. Electrical stimulation, is that something that your body will accept? That's something you need to talk to a therapist about. Range of motion, we know, does not help with contractures. We know it's more about comfort. Lots of people will fight me about this, but I think the research is pretty good to suggest that 10 minutes of range of motion is not going to fight against 23 and a half hours of being positioned in a position that doesn't put your muscle on a stretch. Positioning is how we maintain muscle length. So making sure if you're losing, whatever it might be, elbow extension, range of motion, you need to spend some time, like multiple hours in a day, into an extension range. They do things like Botox plus casting and that kind of thing. Oh yeah, sorry, we can't fight contractures. Probably we can't do it alone, and it's not easy. Surgery plus injections plus casting or really diligent positioning are really the only successful treatments in paralyzed muscles. Not sure if you have any more questions about that.
I think so.
I don't have any new and exciting things to say about that. Okay, my last thing is explaining. I said this is a quad problem, but in thinking about it more, it's probably for everybody. A motor unit is one nerve that feeds many muscle fibers. So you see in this little picture at the bottom, there's two motor units, one in blue, one in purple. This is obviously just a drawing. It's a lot more muscle fibers than that. We all lose motor units as we age. That's natural physiological aging. Our bodies compensate by asking the motor unit that's living. So if you lose motor unit 2, motor unit 1 will try and take over for motor unit 2 by feeding those muscle fibers, which is great up to a certain point. The problem is if you are the problem is that over time you get to a certain point where it can't take over anymore because you're losing too many motor units. In addition to, if you are a quad, you already lost motor units in those muscles that are partially innervated. So let's say you're a C6, but you have some tricep. Part of that muscle is not totally innervated, which is why it's not as strong as it once was. You already lost those motor units. Now you're losing more because you're aging. So you started with a lower number, you get to a certain point where you've lost so many, you get to what we call this physiologic threshold. So you've lost so many that you can't do the thing you could do 2 weeks ago. I mean, it's not usually quite that quick, but some people really feel like it's super quick. You get to a point where you're like, I just can't, right? So you've lost so many. So just knowing that there are these moments where your body tries to keep up, tries to take over. And then at some point it's sort of saying like, you get to a certain point where it can't take over enough. If that makes any sense.
Yes.
Yeah. So just to like think about that, I think is sometimes helpful. Knowing that it's not like because you're not trying hard enough, it's because your body gets to a certain point. Yeah.
Okay.
I think that's it. I think,
Okay.
oh wait, no, let me check. Oh yeah, we want to talk
no.
about posture. We talked about this already. So there's lots of strength training guides out there. We created one here, the Taking Care of Your Shoulders After SCI, which is 3 stretches, 3 strengthening exercises, the absolute bare minimum to take care of your shoulders. I can send that out. SCI Action Canada has one. There's something called the Stomps program. There's lots of great strengthening exercises. The thing is, what are you going to do? Find something that you will do. As long as it's not painful and you will do it regularly, that's great. If you can make it moderate to vigorous, that's better. If you can do it with heavy weights to actually strengthen the muscle, that's better than that. But basically, will you actually do it? Find a person, find a cookie, find something that will motivate you to do it, because it's more about motivation than it is about telling you the perfect exercise to do. Kim?
This is a fantastic presentation. I hope that you will come back. But I noticed we only have 5 minutes left. And
yeah, I'm sorry. I don't know how it happened.
Things in the chat. Yeah, I don't know. It's just, I think when you have a great conversation, time flies. But there's 2 things in the chat that people wanted to get to before the end of the meeting. So
yeah, sorry.
I thought I'd just mention that. But for
Yeah, let
you,
me-
there's one question or one comment from Paul that says, most importantly, we need to do exercise, diet, and practice good posture ourselves rather than hoping for an operation or medication to fix our problem.
Yeah, great
Prevention.
point.
Yeah. And then Marty and
Here,
Jeff
here.
have something.
Yeah. Yeah, the diet. I could talk forever about diet, not even being a dietitian. I just think the longer I do this job, the more I think your diet is probably one of the bigger taking ways you can take care of yourself. Cutting out the bad stuff, putting in the good stuff. Like I do a talk on pain, and that's probably the number one thing I really suggest to people is really look at what you're putting in your body.
And we will probably do a session on nutrition at some point.
Yeah, please do.
Is that it? Tova, is that the end of your slides?
Yeah, so it's just like stretching and strengthening. I don't know. We don't really have a ton of time to talk about that, but there's lots of great resources. I'll send some along to Duncan to share with you. I can come back and talk more about that if you want. It's just really anything you'll actually do is good and not painful, and keeping yourself strong. There's no one exact exercise that's perfect. It's really, what are you going to do? What makes you stronger without making you more painful? Stop if it's really painful. Get some help if you need it.
Yes, it's not no pain, no gain anymore.
Yeah, sadly, wouldn't that be great? Yeah, so I think just find what works for you and try not to hurt yourself.
And in our short little bit of time that we have left, does anybody have any questions that they really want to pose to Tova? We'll get to that. And if we don't, maybe we can go on a little bit around apparatus or methods to decrease or improve the ability to transfer. I mean, I know. Oh, Sean, is that your hand up? I can't hear you. I'll unmute.
Oh yeah, you're muted, Sean.
You're muted. I'll unmute. There, you're unmuted.
No, I'm not. I'm okay. Sorry.
Oh, you weren't asking a question.
No, I just flipped
okay.
my phone around. I'm still trying to figure out how you use my phone as a Zoom.
Yeah.
All right. No problem. No problem. Just in terms of apparatus and things like that, I mean, Tova mentioned slings a lot. And Tova actually introduced me to a lift, an overhead lift, which I now use, that doesn't have a sling. It has two pads under your armpits and two hooks under your knees. So hygienically, it's great because you're not sitting or bathing and then getting into a sling. You're just basically hanging in the air, and it's really good. I can do it independently. So it makes a big difference. Okay,
What's the name of that lift?
It's called an independent lifter.
Okay.
So original. It's that's a great device. Duncan can tell you it's a little pricey. If anybody wants to come up with a less expensive one, we could probably make some bucks.
What you need to do, I hate to say this, but what you need to do is order it direct from the US and get them to write it up as medical equipment because the price is about half.
Really? I didn't know that.
Yes, it's amazing.
Gotta know the tricks.
Yeah.
I love that. It's such a great device. Super smart. Like, when somebody comes up with something and you're just sort of like, yeah, of course, this was the right thing. So.
Oh, Marnie and Jeff have raised their hand.
If we could just mention the soft wave therapy.
Yeah.
Yeah, we've both tried it and really had, I've never had pain relief in my shoulders ever. And to get some relief for 3 decades was incredible till it kind of wore off. But I do know, that the more, just like any kind of most therapies you do, the more benefit you get, right? The longer it kind of lasts. How about you, Jeff?
Well, Tova, have you ever heard of that soft wave?
No, I looked it up when you sent it to me, but I hadn't heard of it before. I mean, I know there's some things that have gone around with shockwave therapy and with red light therapy. Not sure how that's related to it.
Like this, I've tried those. They're nothing like this.
It's cool.
And you know when they're using it. I'm telling you right now, you'll know it's gonna work. You'll know it's gonna work because it hits the pain spots, and I guarantee he'll get you tapping out before before he's finished. You'll be
That's
seeing-
good to hear.
Stop,
That's
stop,
good.
stop.
And you put the link in the chat box, right?
Yeah, that's right. That's so
And the
that's
only
cool.
problem is it costs like $150 a session. And
Yeah.
it would sure be nice if GF Strong or something started utilizing these things, because I guarantee it would fix shoulders.
Yeah, it's challenging to keep up with the technology. Yeah, we
And-
finally, I mean, just getting a functioning FES bike and then some devices, and now we're going into a time when we are having big discussions around the epidural stimulation stuff. Just getting devices that will keep up with even the bare minimum of technology is a challenge.
Supposedly
yeah.
used in Denmark and Germany, and it's a part of their medical system. That's what I understand.
Yeah, it's been
Yeah.
around for years, right? It's too bad.
That's yeah, I mean, it's so good to hear, and like sharing amongst yourselves and like what works for you. There's so many things I've learned that it's just really about figuring out, trying. You kind of have to go on that journey of finding what is the right mix for yourself. For me, for my pain, it's acupuncture, exercise, trying some massage right now. It's not really working for me. Everybody's body's just a bit different. If it was all the same, it would be so much easier. It's unfortunately, it's not a straightforward journey. You have to go on it and really figure out what the right mix is for you. And knowing that it's not straightforward and it is hard, and knowing that that these things are going to take time and going to take a bit of probably wasted money, and that's just unfortunately the reality.
Speaking of acupuncture, boy, I had really bad tennis elbow, and acupuncture right into that very most sore spot helped me immensely. It was
it's for me again. It's just been I've been on that journey for a long time myself, and it's just I know what works for my body, right? That happens to be the thing, and I'm lucky I have really good benefits. So I get to walk across the street here at GF, see my physio, and I got to go later. I'm already a little scared. There's a lot of yelping when he does it, but I know it works for me. So I know it's how I manage my strange little body.
It has worked for me in the past too, but everybody's different, and some people it work for, some people it might not. I want to get back to the tools that we use for transfers and things, so people get the information. And I had one more that I was going to mention, and I know that Paul uses this as well. It's actually a lift for in your tub, and it just sits in your tub, and it's called an Aquatech. It raises up, and it's got a little flip over thing that creates like a sliding board almost into the tub. You get in and you can lower yourself to the bottom of the tub. Now, Paul, I know he uses it to get in and out of his hand cycle. So and it's not exceptionally expensive, and you can get them used a lot. But it's a really unique and useful little item as well. Especially if you're having trouble getting in and out of the tub.
Yeah, for sure. Yeah, I mean, that's one more thing that I think, in terms of things we don't recommend anymore is getting in the tub, which seems crazy because people, having a bath is a nice way to we do a lot more like shower chairs and bath benches and that kind of thing.
Yeah, in my time, if you didn't get in the tub, you didn't get washed.
Yeah, that's it, right?
I had to learn how to get in and out of the tub.
Yeah.
It was hard.
Yep.
And I'm wondering, has anybody else got anything else unique that they use? I know there's smart drives out there for power assist, and there's other power assist systems out there.
Yeah, I could give you a whole talk on just power assists and all the things we've learned in the last few years about those.
That would be wonderful, actually.
Oh yeah, sure, yeah. I mean, it's such a great
it?
technology, but it does. There's some things you need to know about it.
Oh yes, you need to learn.
You need to learn, and you need to learn, how to just the things you don't even think about, like making sure you're visible. Like we've had not more than one person get beamed on them just because you're going fast and you're low to the ground and stuff. So.
And if I could add, like, I totally agree with the power assist. That's why I wear my phone around my neck all the time now. I almost died the first time I tried one out in San Diego, and it's because I turned a corner too fast and I almost died.
Totally. Yeah, the cornering on the power assist is a skill you need to learn.
Yes.
I almost lost an inpatient. I watched him go around the parking lot. What was I thinking? He was a teenage boy, and I left him alone with a power device. And I watched him go on one wheel, and just about, he was able to get himself back. But when you ask, well, how did Tova leave GF Strong? That'll be it. No, I'm just kidding. But
No, those are, I mean, those are really good points. And the power assist as well, you have to realize that its whole goal is to maintain a speed.
yeah.
So if it hits a hill, it actually speeds up.
Yeah,
So
just
you
learning
need
like
to
the
lean
quirks of
forward.
each one. Yeah, I mean, I think it's such a great tool, but it should be like a car. You need lessons.
Yes.
You
So
need
yeah,
lessons,
it's
and you need a chance to try them rather than
totally.
have to buy them first and
Yeah.
then discover their shortcomings. you know?
Yeah, no,
Yeah.
we've done some stuff around that just because we brought in that. I know a lot of people, I don't know if here in this group, but certainly lots of people have been trying the one from China. And we actually got one here at GF just because we were like, people are getting them and we're like, we don't even know, like people don't even know if they can get them on their chair. So they're cheap,
Mhm.
but they're also cheap. So
Yeah.
just but like, yeah, it's been an interesting time in that technology space. Just to see how much it's changed. But just knowing it puts some stresses on your chair you may not know about. It puts some stresses on your body you may not be aware of. And it does come with its own set of risks. So that's been an interesting thing we've worked through here. I mean, we're certainly in the process.
I'm wondering, Tova, do you know if any of the retailers like National Mobility or what's the other one, McDonald,
Yeah,
do they do demos of these things? Will they
they do.
actually
Yeah,
take the
they'll do the
time?
smart drive and the, oh gosh, what's the front power assist, the pause. Sorry, that's the
Yeah.
one right now. I mean, things change over time, but the pause and the smart drive are the two. So smart drive in the back, pause in the front. Those would be the two that we've sold the most of. There's lots of other stuff out there, right? The pause is, I like it because you don't have to change your chair to get it. Whereas I would say if you're going to get something like I'm sorry, I just lost my words. The other front
Bartech or
Baytech, thank you.
Baytech.
Your Baytech, you got to be careful with your chair setup with that. Whereas with their the pause, you can set up your chair the way you like, and then the pause will fit you. So we've been doing
For
more of
people that
those
don't
lately.
know, the pause is kind of a Baytech type device,
Mm-hmm.
but they've made it so that it just hooks onto any chair,
Mm-hmm.
just clamps on at the front, and they've actually made one version, which I haven't seen yet, but I've heard of, that actually hooks onto your chair automatically.
Yeah, the quad version.
Yes,
Yeah,
which is very
she's a
cool.
big sucker. You really have to commit to wanting that thing, but
Yeah, it's
I
a
mean,
10
it's
grand.
cool.
It's
Listen,
another
there's
10 grand thing.
easily. I think the quad version, I actually
More
would
than
have to
that?
check, but it's like 15-ish.
Yeah, they're
So yeah,
crazy.
so you have to figure out what is it worth it to you, what really works with your life. Is it better if for that same price you could get a reasonably good power chair? Does that make any sense whatsoever? We've been
Well,
fighting with,
the question for me would be, is it more, it's less than a power chair, and it gives you, in my mind, a few more options because you can go
definitely,
anywhere you can go in a power chair, but you can just
but
remove it
your
and be in your
manual
manual.
chair and the power assist together is just a bit, in the end, I've done this recently, a little more,
Is it?
right? So power assist
Oh,
plus a good manual chair is going to be more than a pretty good power chair in some
so
cases, not always.
I'm kind of talking from the aspect of people that already have a manual chair.
Yeah, absolutely, no question. But if you have to need a new chair setup, but anyway, that's not always the discussion, right? Like it's what works for you in your life.
Yeah.
And just knowing, I think it's just constantly changing. Like there was the tri-ride and then there was this. And so like we as therapists spend a lot of time just keeping up,
Oh, and you still will. It's going to keep going.
Oh yeah, which is great. Listen, it's I think for lots of people it's been a huge boon in terms of like quality of life, and for some people it's like way better in terms of where they can go with it. But I would just say making sure if you're going to get one, you change the wheels on your chair because you don't want high pressure wheels. Anyway, I'm maybe getting too much into it, but I have thoughts.
No, I know what you're
Many
saying.
thoughts.
You have
I know
those
what you're
thoughts.
saying, and these people, the people that you're talking to, might be considering it and need to know those kinds of things. Like the other thing that I've heard is you need to get wheels with stronger spokes because you're
Yeah.
going to go faster and you're going to go harder over bumps and things, and your wheels are going to
Yeah.
break down.
Yeah, I think that we've tried to manage that through, a pretty good wheel, but more of like a bigger tire, lower pressure tire. The high
Yeah, well, that
pressure
would be
tire
good.
and a power assist is a bit of a mistake in my opinion.
Yeah.
Why do you say that, Tova? Because that's the combination I've got.
And if it's working for you, that's good. I think the thing is
No,
that it transfers a lot of a lot of forces directly into your chair, because your high pressure tire is gonna like really do a lot of this, as opposed to accepting some of the forces. If you go over a bump, the mountain bike tire or lower pressure tire will accept, like, just sort of like cushion the blow.
So you mean
for
it transfers the blows to me? Is that what you're
Yes,
saying?
that's right. It's transferring the
Yeah.
blow to your chair frame and then into your body.
Yeah.
So for
I
some people,
have-
like, their spasticity goes nuts, or
Yeah.
they notice
Pain
their
levels.
yeah, their
levels.
pain.
Yeah.
They notice that the components on their chairs are like loosened up, that kind of thing.
Yes.
And the
I've noticed.
vendors hate it because they're doing so many service calls on chairs like that. So some of them are like, I won't do that anymore because it's too much
Yeah.
work for me to
I've
sell a
run into
manual
that.
chair with the power assist and not set a second set of wheels.
So is there a caveat section of things learned about power assists?
I have a statement paper I give to therapists. I'm happy to give it to you guys if that's helpful.
Oh, that'd be great.
Oh, yeah, if you can include
Um,
that, I can forward it.
Yeah, sure. I can send that. I'll send all the resources I talked about today,
Oh, that's wonderful.
and links and stuff. It's not like I don't tell any secrets that only therapists should know. It's just like things to think about we've learned. Make sure you're visible. What about the wheels? What are different ways to deal with the wheels? There's some other technologies out there. So yeah, I'm happy to share that.
That'd be wonderful.
I want to thank Tova for a great presentation.
Oh, it's such
Really
a
good,
pleasure.
really
All sorts
good.
of stuff we needed to know, and confirmation of other things, and lots of discussion. You guys are great at asking questions and being
Yeah.
involved in the discussion. I think that probably helps Tova with the presentation.
Yeah,
But I want to thank her very much because she did this voluntarily.
it's my
and,
pleasure. Helps to talk to real people, remind myself what I'm doing here. Yeah, we're really deep into, just so you all know, we're deep into work with Rick Hansen Foundation and with a lot of the docs here to really try and improve the way we manage SCI in the long term. Can't talk too much about it, but just knowing that, like, I'm on the crusade, that the work continues alongside you all.
things
Well,
will
thank
continue
you.
to change, as they always have done and always will.
Yeah.
So I just want to thank Tova and thank you guys for being so involved.